And as I'd mentioned, really appreciate everyone taking the time here on Friday to join this webinar. And just to give you folks a little background on myself, I'm George Homer. I'm a vice president here at EverFi. Been with the organization for a year with the acquisition of Law Room. And so if you folks don't have historical context, Law Room provides your online training for employees for sexual assault and sexual harassment through your system. And so I've been with Law Room for 8 years, helping campuses with online compliance and prevention training. And so I'm super excited to walk through today with you different aspects of our student program. I will mention that I'd like this to be interactive. So if there are questions throughout the webinar, certainly you can put a question in the question box and we can address those specific questions throughout. This should take about 30 minutes. I will pull up the agenda, but I would like to mention, so I have the unique opportunity to work with and visit dozens of campuses that are more strategic in nature. And so I've gone to about 50 campuses over the last 9 months, and certainly I don't sit in the seats that you folks occupy, but I do get to speak with many folks that do. And so I'd like to share some of those insights before we get started. And so with the arrival of the amendments to Clarity through the Campus Save Act, the vast majority of campuses we speak with are training incoming new students around sexual assault prevention, which is outstanding. In 2014, we saw the DOE expand the scope of sexual violence prevention training to include all students and employees on an ongoing basis. This dramatically increased both the responsibility and complexity in addressing sexual violence on campus. And so most of the campuses we speak with now, both from a compliance and prevention best practice perspective, have scrambled to build a campus-wide program, and we know this creates huge challenges. We also are hearing from college and university presidents who, after the White House guidance published in January of this year under former Vice President Biden, have been seeking a consistent prevention initiative on campus. And to quote the White House guide, we need to provide repeated exposure to consistent prevention and education messages and programming throughout a student's tenure. So brief one-time interventions, especially when focused on only raising awareness about sexual misconduct, aren't usually effective for creating lasting behavior change. So again, we see a growing commitment for wide-scale educational initiatives around sexual assault, but also a growing concern around how institutions can build and maintain such an expansive program. We also see really bridging the gap between faculty, staff, and student training and having a consistency of messaging across the board and a consistency of data and tracking. And so most of the deans of students and student affairs folks that I talk with have really been focused on the sexual violence prevention through their student experience, but we're also seeing an increased interest in how their counterparts across campus, whether it's a VP of HR or the general counsels, are approaching these critical topics to ensure a consistent and cohesive message on these topics. So from a compliance and prevention best practice perspective, having educational programs that are built in concert with consistency of messaging and consistency of data and recording presents a difficult challenge for institutions. And I think lastly, one of the things that we see more and more of over the last year or two really involves the increased scrutiny in how campuses are addressing sexual violence and substance abuse on campus. And we're really seeing a higher bar in terms of efficacy and outcome standards for training initiatives. And so this is giving rise to both efficacy-based training programs as well as campus-wide climate survey initiatives as a long-term benchmark mechanism for measuring change in attitudes and behaviors surrounding sexual violence on campus. And ultimately, we know that most campuses today are reluctant to invest heavily in prevention programs that aren't based on efficacy and best practice. And we see this as an incredibly positive trend across higher education. And so to talk about our agenda, and this should take about 30 minutes, we'll go through alignment indicators. We'll talk about expanding the mission, so where we were and where we're going. We'll talk about course content, so what's available in the marketplace and how are we serving campuses in the most cohesive way possible. We'll talk about data and integration, and so as we look at this becoming a much more permanent initiative on campus, we know that having a automated and integrated approach makes sense and makes everyone's life easier. And so how do we address that in the most efficient and scalable way possible? And then customer support. So EverFi has been implementing higher ed institutions for the last 15 years, and so really helping ensuring that folks are supported, that customers are successful, and that we're ensuring that there is resources 24/7, 365 for anyone who is using our programs. And then lastly, the network effect. And so 1,700 campuses, 9 million folks trained in our network. And so how we're essentially serving those folks moving forward. And so to talk a little bit about really the alignment indicators. And so our compliance and prevention teams have come up with 5 core elements that go into a successful online education program. And so I'd like to share those with the group now. And so, for first step is compliance. So for many of our customers, compliance has been one, if not the main motivator for implementing sexual assault prevention on campus, which is outstanding. The folks that implemented and enacted the legislation really knew what it would take to move the needle in a meaningful way, which is why these laws have been enacted. Course content is critical, so we use a multi-learning modality approach with audio, video, and case studies to really engage the learner and foster high adoption. The educational design needs to fulfill its mission to educate and engage, and that means that the program needs to be designed for its intended audience. So whether that's a 19-year-old new student, a 30-year-old graduate student, or a 50-year-old tenured faculty member, we know students and employees have incredibly high standards in how they consume content, and we're more committed than ever to making sure that our content continues to meet those high standards. Administration, so it's not enough to build and customize a great program, it has to get there. So there has to be an intuitive learning management system, an electronic notification system, preferably one with automated email reminders, so this doesn't become someone's full-time job. And then lastly, data is critical, and so having good data that gives you information about outcomes and impact can really help drive strategy or justify budget spend. And so having robust insights into your program is really what this is all about, is showing that there is behavior change that's being effectuated. You are able to justify budget spend, drive strategy, and really look at this holistically with interventions on campus. And so to talk a little bit about the White House guidance, and I'd mentioned this in the initial overview. So we know that ongoing prevention, campus-wide education and compliance solutions are critical. And the first part of the school, August through October, is when sexual assaults are most likely to happen. So certainly we want to make sure that we're providing the most robust programs available during those times. But we also know that this needs to be distributed throughout a student's tenure. So once and done programs aren't effective for lasting behavior change. And so having the ongoing perspective where we look at this as historically, EverFi has really serviced campuses around primary prevention, but we know as the legal requirements have expanded, we know as best practice has really firmed up around dosing and providing a sustained effort over time, we've had to think about this in a much more cohesive way. And so what we've done is developed ongoing training that addresses a primary baseline program in year one with substance abuse and then sexual assault prevention, but also has ongoing continuing student courses, so that these are refresher courses. They're about 15 or 20 minutes. They change every year so that folks don't have to go through the same material, and you have that longitudinal data throughout the student's tenure. So you can continue to have great data, not only in the first year, but in the remaining years that they're on campus moving forward. And we know that these single dose, once and done programs lack sustained impact. And so having materials that are very much dosing, having ongoing training, having other resources, whether it's on prescription drug abuse, opioid abuse, mental health, bystander intervention, those are all ways to make sure that this is a comprehensive substance abuse and sexual assault prevention solution. And so what's really interesting is when we look at Title IX, we think of sexual assault, but we also know that compliance cannot be attained for Title IX without addressing alcohol. And so having alcohol-specific information on campus really helps to continue to provide the required material. And I'm sure you folks know that Penn State had a major fine, $2.4 million levied against them about 6 months ago, and that was behind an Edgar Part 86 alcohol and Title IX complaint. And so having that information in your programming, making sure that you're addressing this holistically is a matter of compliance. And then looking at the Edgar Part 86 requirements, we know that having materials to support your biannual review is just one of the many things that EverFi does. And so these expanded programs that we're providing is essentially really helping to make sure that you're meeting those requirements and being able to demonstrate evidence around those areas. Talking a little bit about expanding the mission. And so historically, as I'd mentioned, EverFi had really focused on primary prevention training for new students and new employees, but we know there's so much more to address compliance and prevention. And so looking at adoption or completion goals reached, actionable data analysis, campus-wide ongoing data integration, benchmarking with peer and aspirant institutions, automated role-based training, and then lastly, a fully integrated student and employee experience. And so right now, the Nebraska system has the fully comprehensive employee side of the house, and so that piece is done. But today we're talking about students and providing this in the most effective way possible. I talked a little bit about some of the risk management areas of this, and so really looking at this strategically. And so when we talk about sexual assault prevention, when we talk about substance abuse prevention, this shouldn't live in anyone's one budget, whether it be health and wellness, whether it be student affairs, because this really is a strategic campus-wide cost of doing business investment. And so making sure that folks are supporting you, whether it be the provost office, whether it be Title IX or health and wellness, making sure that everyone comes together and is aligned on this is really critical to making sure that you have the most effective way possible. But this is not a nice to have, this is a need to have, and really able to do business as a higher ed institution and addressing these risk management topics. So we know from a risk management perspective, so having sexual assault prevention is critical because it's around student and employee retention or admissions or donations or reputation or the cost of litigation or the cost of an average complaint or alcohol related student success or reputation or attrition. We know that those areas are really hard to quantify, but when we do quantify those, it's huge in the tens of thousands, hundreds of thousands, and in some cases, many, many millions of dollars. Looking at the compliance side, we know that there's strategic requirements here around Title IX, CLARI, Edgar Part 86, Title VII, ADA, and FERPA. Addressing course content, and so your campus may not look like this, but we know that in many cases, campuses are in some cases very decentralized and siloed. And so what we're seeking here to do is provide a consistent message that allows for good tracking, allows for good data, so that you always have really the material that you need should a complaint or other type of litigation occur. And so ensuring that everything is available, is accessible, are really critical pieces to having the successful student solution. And so one of the interesting things about EverFi, so as I had mentioned, historically, we had provided this partial solution, once and done program for 25% of the population in the form of new students. But we know that that doesn't align with compliance requirements. It doesn't align with best practice from a prevention perspective. And so we've broken this up really into primary and ongoing courses. And so the way that we structure our program, it's not an a la carte option. It's an unlimited access site license where you use anything that we have based on the system purchase, which is larger campuses pay more than smaller campuses. But this really allows you to maximize your course offerings. And so currently we have alcohol prevention in a separate course. We have Title IX. We have Title IX to address undergrads, grads, adult learners. We have prescription drug abuse to address opioid use, which is a huge problem. And then we have ongoing courses around Title IX, looking at alcohol prevention from a refresher perspective, and then alcohol sanctionings. And so I see that we do have a question here, and so I will field that. So the question is, how are the alcohol stats quantified? And so, and I'll be getting to that here in the next minute or so under the data integration. But really what we're providing are pre and post tests for students. And so there's different types of survey questions. There's formative knowledge and assessment questions. There's bystander intervention questions, and this is all anonymized so that you can go in and pull reports and see overall in an aggregate format how students are responding to the program and where there's areas that need to be addressed. There's also the ability for student engagement, student recovery, student leadership opportunities. So it allows students to communicate with you where there's areas that they may be of need. So abstainers may communicate through the course and say, we'd like to know where more abstainers are because we thought there actually aren't a lot of abstainers on campus. And so having those resources really allows you to maximize and scale your program in an otherwise very challenging way. And doing this in a different way and quantifying that and really learning about student behavior can be extremely challenging. And so this is an outlet to make it as simple and efficient as possible. And so, so we have some flagship programs around sexual assault and substance abuse prevention. And so Haven has been a course that we provide. EverFi acquired Law Room and Campus Clarity and Workplace Answers this last year. And so we have other assets for Campus Clarity, but really Haven and Alcohol EDU are the two flagship courses that are evidence-based and efficacy proven. And so what's really great about Haven is it seeks to engage the healthy majority, because many students that come onto campus don't know that actually most students, the majority of students are healthy, have healthy behaviors. And it's a very small minority of students that don't have healthy behaviors. And so we want to make sure that we're addressing these healthy behaviors and acknowledging that so that people don't have preconceived notions that they are, if they aren't having healthy behaviors, that they are the minority, when in all actuality, they are the majority. So we have programming for sexual assault to address consent, communication, healthy relationships, domestic violence, dating violence, stalking, all specific to Nebraska state law, bystander intervention, risk reduction, policies, and customization. And so what's really great about our programs is they're developed by not only our in-house experts, but external experts. So we have federal, so VAWA negotiated rulemaking folks who were on the rulemaking committee that helped build our course. So for Jill Dunlap, Holly Ryder-Milkovich is actually an employee now at EverFi on our prevention team, Lisa Irwin, and then Dr. Alan Berkowitz, who are all renowned experts in this field. One of the really great pieces of our programs for students is the customizable features. And so you have the ability to insert logos and images and welcome messages and videos and local and state definitions and campus policies and campus resources and student leadership and engagement. And so here you're able to essentially address this in the most robust, effective way possible, and you don't have to pay to do this. You can customize these courses for students yourself at no cost through the platform. So it's a very easy endeavor and doesn't require any expertise to do. So we have over 1,700 campuses, and many of those folks do choose to customize their programs. And it really comes down to what we're required to do equaling doing the best work possible. And so we want to make sure that this is the most robust program available and doing this to really help make a difference on campus. We are not the check the box solution. And when the Nebraska State College system picked our employee program, it was not a check the box solution. They could have gone somewhere else at a lower price point and gotten something that wasn't robust, wasn't compliant, and wasn't effective. We also know that diversity is critical. And so having diverse courses that are real world, that show all of the different cultures and ethnicities, and really addressing this holistically and equitably. Getting into some of the alcohol prevention programs, and so having different scenarios that students can recognize, and really learning by doing. So there's different simulations, there's a branching, choose your own adventure type approach. And so we know that having courses that are very engaging and very realistic and that resonate are critical, but we also use adaptive pathway learning so that as students that are abstainers are taking these programs, they're going to continue to get information directed to them as they go through the course as an abstainer, and that's called adaptive pathway learning, whereas a problem drinker student would get information to help them not be a problem drinker, to help them to be better and really not abuse alcohol and strategies to make a difference and change. And this just gives an outline here of factors that can affect BAC. And so eating some food, whether it's drinking soda, whether it's in a dorm room, and really addressing the timing, sleep, all of the critical factors that go in if people do decide to drink, these are ways to make sure that they're minimizing how much that can affect them. Looking at the laws, and so knowing that these are different types of laws, so Nebraska may be different than California, than New York, et cetera, and so having these be state specific are critical, so the student drops down the state they're in and gets to see the alcohol laws in their respective state. And so I'll pause there. Any questions or thoughts on any of this that you'd like to share in the question box that I can address now before we move on to the data integration piece? Great. And so getting into data and integration, and so there was a great question here about the statistics, and so EverFi really has the most robust data analytics around in this market, bar none. And I'm not just saying that because I work here, because I actually competed against EverFi for the last 4 years, and their data analytics are unmatched. And so having the ability to provide bystander intervention information, examining changes in drinking rates or high-risk drinking or student experiences or knowledge gains, informative assessments, or other types of impact and outcomes is really a hallmark of what we do. But we also allow you to benchmark, whether it's a custom benchmark, whether it's a regional benchmark, and really address this from a peer type campus or regional type campus. Looking at here at preventing an alcohol overdose or preventing alcohol poisoning, and so showing how students, how equipped they are to address these critical areas to either intervene or help themselves with these critical topics. And then student engagement opportunities. So students can self-identify and say, I'd like to be in student leadership, or I'd like to have activities for abstainers, or I'd like to know about recovery because I'm in recovery, or I'd like to have these other types of resources. Are really a foundation of what we do here to make this, to help you to get these informations as practitioners that otherwise you may not have. And then getting into customer support. And so as I'd mentioned, EverFi has been supporting campuses for the last 15 years on the customer success side. And so having really the best customer success out there is a core function of what we do, but also having end user support is critical. And so we have 365, 24/7 end user support, so that anyone is actually in a course, off hours, 2 in the morning, whatever it is, they can reach out to our help desk, which is powered by Blackboard. And no other e-learning company does that because it's really hard to do and it's really expensive to have those types of resources. And so we want to make sure that what we're putting out here is the best possible solution, so that you're not getting information in your inbox that's going to require you to do more work. And then the network effect, and I know we only have 5 minutes left here, and so 1,700 campuses, 9 million folks trained per year are EverFi partners. but we know what does it take to pull this thing off. And so the courses, the platform, the technology can only be as good as the folks behind them. And so, so here we're providing a team of over 100 employees every single day that are dedicated to doing this. And these are prevention experts, public health experts, attorneys, engineers, developers, instructional designers, content writers, renowned researchers, customer success managers, IT experts, to really make sure that this is a program that is supported, that is backed by the best in the business, and that is robust. Campus Prevention Network. So this is our network of 1,700 campuses with thought leadership, and these are folks that are dedicated to lasting large-scale change on these critical topics. And so here we're able to provide the Campus Prevention Network website with different types of thought leadership, different types of webinars and other types of interactions to make sure that we're raising the collective intelligence in this space so that folks, we're lifting all boats with a rising tide of information to help make a difference on campus. And so I will pause there. So we do have some questions here, and so I will address that. So what is the length of your one-year sexual assault program, and what is the length and content for the substance abuse? Given an idea of a time a student will spend in year one taking these courses. And so for the baseline, new students, brand new to the institution, first year, just coming in, so we have a couple different modules. So we have a sexual assault standalone, which is about 45 minutes. We have an alcohol abuse prevention standalone, alcohol EDU, which is about an hour and 15 minutes. So 2 hours. Now we do have a combined campus clarity course, which has less alcohol and drugs. So it's not a comprehensive program. That's about an hour and a half total. And so in year one, it's essentially a 1 to 2 hour endeavor across the board, and then in the out years, you're looking at 20 minutes for sexual assault prevention and 20 minutes for alcohol abuse prevention. Another question here: have other colleges integrated these courses with learning management systems such as Sakai? And so currently, what's interesting, we have separate platforms. So we have a student platform and we have an employee platform. So the student platform next year will be able to integrate in through an AICC or SCORM protocol with other learning management systems. Right now it doesn't, because it has a learning management system with all of the robust functionality that's specific to this prevention type of course and compliance course. But certainly over the next 12 months, we will be able to integrate in with other third-party learning management systems. And then the last question was, would you send us this presentation? And so I'm going to send this to Taylor Sinclair, who has been instrumental in helping put this together, as well as some course access that you folks are able to take and view on your own. Any other questions before we end this? Well, I really appreciate everyone's time today, given that this is Friday afternoon. Thank you so much. I really appreciate you joining us and taking the time to hear what we have, and excited for the opportunity to expand the existing relationship with the Nebraska State College System. Have a great weekend, everyone. Thank you. Bye.